Welcome back to this session, and we are going to look at drug classification and drug sources. Now, these are very important topics in basic pharmacology that you ought to know. Now, let's first talk about drug classification. Drugs are classified basically based on two things or two classifications. We have what we call the pharmacologic classification and then what we refer to as the therapeutic classification. Now, what is the pharmacologic classification? By pharmacologic classification, we mean that drugs are classified according to their similar characteristics, how they behave, their similar makeup, what they are actually made of. So basically they are classified according to their characteristics and their makeup. Like, for example, penicillins and beta blockers. We are going to see that these are completely different drugs in terms of therapeutics or in terms of what they do. But however, they have almost the same characteristics and same chemical makeup. In pharmacology, they are classified as, this is what we refer to as the pharmacologic classification. Now, this is not very important, I must say, in clinical medicine. No. In clinical medicine, the most or the widely used drug classification is what we refer to as the therapeutic classification. Now, what is therapeutic classification? With therapeutic classification, drugs have the similar effect. Like, for example, I'll say if you have an antihypertensive patient and you give them a certain drug or even another drug, we want at the end of the day to have the blood pressure come down. Now, these drugs do not necessarily have to have the same characteristics or even makeup, but they end up reducing the blood pressure to the desired. Now, that is what we refer to as therapeutic classification. Like, for example, we have so many antihypertensives. Now, at the end of the day, remember, for a hypertensive patient, the problem is blood pressure. The problem is blood pressure. And we know very well that blood pressure is a product of cardiac output and total peripheral resistance. So if you give a drug or an antihypertensive that will basically help lower this or lower the cardiac output, essentially it will have lowered the blood pressure if you keep the total peripheral resistance a constant. Or if you give a drug and this drug lowers the total peripheral resistance, then essentially that drug will have lowered the blood pressure. So that essentially means that these drugs do not necessarily have to work the same way, or they do not necessarily need to have the same makeup, chemical makeup, and they do not necessarily have to have the same characteristics, but they end up doing the same thing. In this particular case, lowering the blood pressure. I'll give you an example of antihypertensives. You have classes of diuretics. You have drugs that are called angiotensin converting enzyme inhibitors, like lisinopril. Now, these medications, their overall effect is to lower the blood pressure. And so we refer to that as therapeutic classification. Now, let's look at drug sources. Now, we know very well that drugs, a source is that from which something comes. So when we talk about drug sources, we mean where do we get drugs from? Now, drugs are got from quite a number of things. We have what we call natural sources and what you would refer to as artificial or synthetic for that matter. Now, the natural sources of drugs are plants, and examples of drugs that we get from plants are drugs like atropine, morphine, pilocarpine, which is used in glaucoma. Animals is another source where we get insulin, we can get gonadotrophins, antisera from animals. Minerals is another natural source. And so we can get minerals like magnesium sulfate, aluminium hydroxide, and most of these minerals that are used as supplements, like for example iron. We also have microorganisms, like for example antibiotics. Some antibiotics can be got from microorganisms, like for example penicillins, cephalosporins. These can be got from microorganisms. We also have humans. Examples of like for example gonadotrophins, which is got from pregnant mothers. We have hormones. Some hormones of the anterior pituitary gland can be obtained from humans. And so those are what we refer to as the natural drug sources. But we also have what we call the synthetic. And here, drugs are made not from the natural way, but they are made synthetically from other chemicals. And so most of the drugs these days are now being made synthetically. Examples of these drugs can be what we refer to as proton pump inhibitors, like omeprazole. We have some antibiotics, and then we have drugs like pacuronium, neostigmine, which we shall find in autonomic nervous system pharmacology. So all these drugs are essentially synthetic. We also have other drugs that are obtained from cell culture, like urokinases, and some of these thrombolytics are synthetic in nature. And we also have, because of the advances in technology, we have what we refer to as recombinant technology. Most of the vaccines, especially these COVID vaccines, were made out of this recombinant DNA technology. And so because of the advances in technology, we realize more drugs being made synthetically and not from natural sources. So that basically tells us that drugs no longer can they be made from only natural sources, but also we can synthesize them from nothing, I should say. And so that marks what we refer to as the plant sources. So, ladies and gentlemen, we have been talking about drug classification and drug sources. We saw that drugs are classified in two ways. We have what we call the pharmacology classification, and most importantly, the therapeutic classification. And when we came to drug sources, we said that we can have the natural drug sources, which are from either plants and animals, or even minerals and human beings. And then we also have synthetic drugs are made from nowhere as a result of the advances in technology.